Okay, let's talk for a few moments about delusions, hallucinations, and illusions. Now, when we're talking about these three concepts, we are talking about psychiatric nursing, obviously, and it's important that you have a good grasp of psychiatric nursing for the NCLEX, because even if you don't work in a psych facility, you see psych everywhere. You see it in peds, you see it in OB, you see it in med-surg, you see it in the VA, you see it everywhere, no matter where you're working. You see it at nursing homes. Everywhere you work, you're going to be involved in psychiatric nursing, even if you're not a psych nurse. Okay, so the first thing that you need to understand, and you have to ask yourself with every single psych question and every single psych patient, is, are they psychotic or are they non-psychotic? Okay, so a psychotic person has poor insight and has ideas that are not based in reality. So that's the first concept you need to consider. The second is that a non-psychotic person has insight and has thoughts that are based in reality. Okay, so if they're psychotic, they have poor insight and their ideas are not realistic. If they're non-psychotic, they do have insight and they have thoughts that are based in reality. Okay, so we need to talk to these two people differently. And I did a whole lecture on psychotic versus non-psychotic patients. But for this, we want to talk about how to communicate with non-psychotic people. And for that, we're basically going to use good therapeutic nursing communication. And there's a whole lecture on therapeutic nursing communication that you'll want to listen to also. Now, let's talk about a couple different concepts in psych nursing. First, delusions. What is a delusion? Okay, delusions are false and fixed beliefs, ideas, or thoughts. Okay, they lack a sensory component. Right? So these are not things that people are seeing, hearing, tasting, touching. Now, there's three types of delusions. There's paranoid, also called persecutory beliefs. And these are thoughts that someone is out to get or harm them. So I had a patient like this one time. I was working on a inpatient psychiatric facility, and this huge guy comes over, super intimidating looking, covered in tattoos, and he had turned out to be a gentle giant, but he was the spookiest looking guy you ever seen. Anyway, he comes over to me and he says, "Now tell me the truth. You see me before, right?" And I said, "What do you mean?" And he said, "There's these people, they put these videos out on YouTube all about me, and you've seen me before you came in here, right?" And so this person thought that everyone was out to get him and that everybody had seen him before and that we were all spreading rumors about him, and it's obviously not true. So he was having a paranoid delusion, okay? He thought that people were out to get him. Right? These are the people that think the government's out to get them, or aliens, that sort of thing. The second type of delusion is a grandiose delusion. These are people who think that they're better than others. All right? Grandiose beliefs are thoughts that they are better than others. So these are people who think that they're the king. They are the one who's in charge. They're running the whole show. They may, talk to you like they're the CEO of some company when really they're not doing anything. All right? These are also people who think that they're the only one who knows something. Right? They're the only one who knows the key to unlocking the secret of the universe, or something like that nobody else knows. Right? And then the last type of delusion is a somatic belief. All right? So these somatic beliefs are thoughts about a body part. Right? So it's different than a sensory component, like we said, because delusions lack sensory components. So they're not feeling something on their body part, but they're thinking something about their body part. So this person might believe that the insides of their body are being taken over by worms all throughout their body, all throughout their intestines. They're going to be thinking that there's stuff growing inside their head, or something else about one of their body parts. Okay, those are somatic delusions. And then we have hallucinations. So a hallucination is different than a delusion because a hallucination has a sensory component and it's associated with a specific sense. Okay, so there are different hallucinations based off of all of your different, the 5 different senses. So you have auditory hallucinations where people are hearing something. These are people who are hearing voices. Okay, the voices telling them to do different things. Sometimes they're telling them to harm themselves or somebody else. These are ones that we really have to watch out for because auditory hallucinations are the most common of all hallucinations. Not many people have olfactory hallucinations where they're smelling things that aren't actually there. So most of them are auditory. I know of a guy, he's a homeless guy who I met, and he told me about his hallucinations, and he would hear voices talking to him, and they were so frustrating because these voices were all in Spanish. And he said, I don't even speak Spanish. He's like, I don't even know what they're saying to me. So when he would go off of his medications, he would start to hear these, and it was problematic for him because he would get sent to prison. He would steal. He had a 5-pack a day smoking history and just loved to smoke. So he would go rob thrift stores and stuff like that to sell stuff to be able to buy cigarettes. So he would end up in jail all the time. And when he ended up in jail, he stopped taking his meds. And that's when you start hearing these hallucinations. The second type of hallucination, again, these are sensory, are visual hallucinations. So these are people who will see things. Okay, now they'll see things that aren't actually there. Okay, they'll see angels flying in the room. They'll see flames. They'll see all different sorts of things. This is the second most common type of hallucination. The third most common is tactile. So these are sensations where they're feeling things on their skin. Right? They're sensing that something's touching them when there's actually nothing there. Right? And then super rare, but still happen, are gustatory and olfactory sensations. Gustatory being taste hallucinations, where they taste something that's not there, and olfactory being things that they smell that are not there. Right? Now, we also have illusions, and illusions and hallucinations can look similar at the onset, but an illusion is a misinterpretation of reality, and it is a sensory experience. Okay, so it's sensory, but it's a misinterpretation of reality. So the person that saw angels in the room just saw angels. Now, the person who's having an illusion will look at the smoke alarm and say that there's a horseshoe crab climbing up the ceiling. Right? It's clearly not a horseshoe crab. It's definitely the smoke alarm. Okay, it's definitely the smoke detector, but they have misinterpreted what is actually there. Right? So that's the difference between a hallucination and an illusion. Right? And an illusion, again, is different from a hallucination because in an illusion, there's a referent in reality that gets misinterpreted. Right? So that referent is the smoke detector that gets perceived as being a horseshoe crab, or the light switch that they think is something climbing out of the wall. These are things that are actually there but get misinterpreted. That's what makes it an illusion. And in a hallucination, they will see something or hear something, but there is nothing there that's getting misinterpreted. Okay, so when you're answering questions about people seeing, hearing, tasting things, or having these false senses of ideas and beliefs, start to ask yourself, is it a delusion? Is it a hallucination? Or is it an illusion? Okay, so differentiating between these is going to help answer psych questions. So real quick recap. A delusion is a false fixed belief, idea, or thought that has no sensory component, and it could be somebody who's feeling paranoid or grandiose or is thinking something about one of their body parts, okay? That's the somatics. Then hallucinations do have a sensory component, but it's not based on reality. An illusion is also sensory, but is based on some component of reality, something in reality being misinterpreted. So that's what you need to know for the NCLEX on delusions, hallucinations, and illusions. And these three things are only experienced by psychotic patients. Okay, non-psychotic patients do not have delusions, illusions, and hallucinations.